Hey everybody, and welcome to the Deep Dive. Today we're diving deep into something you encounter at every doctor's visit: vital signs. You know those basic measurements that tell us how your body is doing? We've got some CNA training materials to guide us. And let me tell you, these materials go way deeper than I expected. It's not just about how to take a temperature or check a pulse, but really understanding what those numbers mean and why they matter.
That's right. Vital signs are like a window into a patient's overall health. They can give us clues about what's going on inside the body even before any symptoms appear.
Okay, so before we get into the nitty-gritty, let's play a little game. Can you, dear listener, name all 5 vital signs? Think carefully because most people forget one.
It's a bit of a trick question these days. While pain used to be considered the 5th vital sign, it's not officially on the list anymore.
You're right. But even though pain isn't technically a vital sign anymore, our materials really stress that understanding a patient's pain level is still incredibly important. We'll definitely circle back to that later. But for now, let's start with something everyone's familiar with: temperature. The source material talks about this constant dance between heat production and heat loss in our bodies. What exactly makes our temperature go up or down?
Well, imagine your brain has a tiny but powerful thermostat called the hypothalamus. It's constantly working to keep your core body temperature stable. When you get too hot, like during a workout, the hypothalamus triggers things like sweating and increased blood flow to the skin, to help you cool down.
So that's why my face turns beet red when I'm on the treadmill.
Yeah.
But what about when we get cold?
Then the hypothalamus tells your body to shiver, which generates heat through muscle activity. Think of it like your muscles doing a little dance to warm you up.
Okay, that makes sense. The materials also mention that things like infections, exercise, and even strong emotions can mess with our temperature. So it's not just about the weather outside, right?
Absolutely. For instance, if you have an infection, your body releases chemicals that basically crank up the thermostat in your brain. It's like your body is trying to create an environment that's less hospitable to those pesky invaders, and that's why we get a fever. Similarly, exercise increases muscle activity, which, as we discussed, generates heat. And even strong emotions like stress or excitement can trigger hormonal changes that impact your temperature, though usually not as dramatically as, say, a full-blown infection.
Got it. And here's something that caught my eye in the source material. It says rectal temperature is the most accurate, but it's being used less often these days. I'm curious, why would that be?
Well, it all comes down to a nerve called the vagus nerve. This nerve plays a role in things like heart rate and blood pressure. And stimulating it, which can happen during a rectal temperature reading, can cause those to drop suddenly.
That definitely doesn't sound ideal, so it's a safety concern.
Exactly. It's fascinating how healthcare practices are evolving to prioritize patient comfort alongside accuracy. That's why you're seeing a shift towards other methods like tympanic ear or temporal artery forehead measurements, which are generally considered safer and less invasive.
Okay, that makes a lot of sense. So moving on to pulse. The source describes it as the force of blood against artery walls with each heartbeat. But we can actually feel our pulse in several different places on our bodies, right? What's the difference between those different pulse points?
You're right, there are multiple pulse points throughout the body, and each one can provide unique insights into the circulatory system. The most common one is the radial pulse, which is located on the wrist, and is generally easy to find and feel. Another one is the carotid pulse, which is on the neck. It's a stronger pulse because it's closer to the heart, and it's often used in emergency situations.
So the location really matters. What about the brachial pulse? That's the one in the crook of your elbow, right? And there's another one behind the knee. What was that one called?
That's the popliteal pulse. And of course, there's the apical pulse, which is measured directly over the heart using a stethoscope. This gives the most accurate assessment of heart function, but it requires special equipment. Knowing these different pulse points and their significance is crucial for healthcare professionals, as it allows them to assess the circulatory system in a variety of situations.
Wow, there's so much to consider, even with something as seemingly simple as a pulse. The materials also mention these terms bradycardia and tachycardia. I'll admit they sounded a bit like dinosaur names to me. Can you break those down for us? What do they actually mean, and what can they tell us about someone's health?
Think of it like this. These terms are just fancy ways of describing an abnormal heart rate. Bradycardia means the heart is beating too slowly, typically less than 60 beats per minute. Tachycardia, on the other hand, means the heart is racing, usually over 100 beats per minute in adults. Now, before you panic, it's important to remember that heart rate can fluctuate for various reasons. Exercise naturally increases it, and strong emotions can send your heart racing too. Imagine you're a CNA checking a patient's pulse after they've rested, and it's consistently below 60. That could be a sign of bradycardia, and you'd want to report it to the nurse immediately.
So context is key. It's not always a cause for alarm, but it's definitely something to pay attention to.
Yeah.
Speaking of the heart's rhythm, let's talk about respiration. It seems pretty straightforward, breathing in, breathing out, but what are the nuances we should be aware of?
You're right that the basic concept is simple, but respiration involves more than just the rate of breaths. We also need to consider the rhythm, depth, and effort involved. For example, are the breaths evenly spaced, or is there an irregular pattern? Are they shallow, normal, or deep? And does the person seem to be struggling to breathe? Think of it like this. Imagine you're watching someone breathe. Their chest rises and falls with each breath. If they're breathing normally, it's like a gentle wave, smooth and effortless. But if their breathing is labored, it's more like choppy waters, with visible effort and strain.
So it's really about looking for those subtle signs that something might be off. What are some of those warning signs we should be looking for?
Well, the materials mention things like cyanosis, which is a bluish discoloration of the skin and mucous membranes. This can be a sign that the body isn't getting enough oxygen. Also, we'd look for things like flared nostrils, the use of accessory muscles in the neck and chest to help with breathing, and a generally distressed expression. Recognizing these signs and reporting them promptly can be crucial in identifying potential respiratory problems early on.
All right, on to our fourth vital sign, blood pressure. I know it's important, but I've always been a bit confused about those two numbers. Can you explain what systolic and diastolic pressure actually represent and why it's more than just a number?
Imagine your circulatory system as a network of highways, with your heart as a powerful pump. Each time your heart contracts, it pushes blood out into those highways, creating pressure against the artery walls. That's what we measure as blood pressure. Now think of the systolic pressure, the top number, as the pressure when your heart is squeezing and pushing the blood out with full force. The diastolic pressure, the bottom number, is the pressure when your heart is relaxing between beats.
So it's like a snapshot of the pressure at its highest and lowest points.
Exactly. And the difference between those two numbers, which we call the pulse pressure, can tell us about the health and flexibility of your blood vessels. You want those blood vessels to be nice and elastic, like a well-maintained highway.
This is all starting to make so much more sense. It's incredible how much information these seemingly simple numbers can reveal about what's going on inside the body. Now let's circle back to that fifth vital sign, or at least the one that used to be considered a vital sign, pain. The material really emphasizes the importance of observing and reporting pain, even if a patient doesn't come right out and say they're hurting. Why is that so important?
Pain can have a significant impact on other vital signs. For instance, someone experiencing severe pain might have an elevated heart rate, rapid breathing, and increased blood pressure. Think of it like this. Pain is your body's way of telling you that something is wrong. It's like an alarm system that goes off when there's a problem. And just like any alarm, you need to pay attention to it.
That's a great way to put it.
Yeah.
But not everyone expresses pain in the same way, right? Some people might try to downplay their pain, while others might be more vocal about it. So how do you figure out if someone's in pain if they're not telling you?
It's about being a good detective and picking up on those nonverbal cues. The materials mention changes in vital signs as one indicator, but there are also behavioral and physical signs. Facial expressions like grimacing or wincing, changes in body language like guarding or restlessness, and even vocalizations like moaning or sighing can all be clues that someone is experiencing pain.
It sounds like healthcare professionals really need to be attuned to those subtle signs.
Absolutely. It's all about putting the pieces together and advocating for the patient's well-being, even if they're not able to fully articulate what they're feeling.
This makes me think of those pain scales they use in hospitals. The ones with the faces ranging from smiley to super frowny. I used to think they were a little silly, but now I see how valuable they can be, especially for people who might have difficulty communicating their pain level.
Those scales can be incredibly helpful in helping patients articulate their pain and ensuring they receive appropriate care. It's about giving them a voice even when words fail them.
That's a really powerful way to think about it. Well, we've covered a lot of ground in this first part of our deep dive. We've explored temperature regulation, different pulse points, the nuances of respiration, the dynamics of blood pressure, and the crucial role of pain assessment. It's amazing how interconnected all these vital signs are, like pieces of a puzzle that create a picture of someone's overall health.
It's true. Vital signs provide a wealth of information, and understanding them is fundamental to providing quality care.
So, dear listener, before we move on to the next part of our deep dive, we have a question for you. We've been talking about vital signs in the context of healthcare, but these measurements can be useful outside of a hospital or doctor's office too. Think about your own life. Might it be beneficial to monitor your own vital signs or those of someone you care about? Keep that question in mind. And we'll explore some ideas when we return for part 2.
Welcome back to our deep dive into vital signs. Before we went off on that last thought, you asked our listeners a really interesting question about when it might be helpful to track these signs outside of a medical setting.
Right. I was wondering if you had any examples of when someone might want to keep tabs on their own vitals, or those of a loved one, even if they aren't in a hospital bed.
It's a great question. And it highlights how these measurements aren't just for doctors and nurses. They can be tools for anyone to better understand their own health. For instance, athletes often track their heart rate during workouts. It helps them make sure they're training in the right zones, pushing hard enough to see gains, but not so hard that they risk injury.
That makes sense. Is it just about performance, or are there health reasons someone might track their heart rate on their own?
Knowing your resting heart rate can actually be a pretty good indicator of overall cardiovascular fitness. In general, a lower resting heart rate means your heart is working more efficiently, like a well-oiled machine.
So that number on my smartwatch isn't just a fun fact. It's actually telling me something important. What about blood pressure? Is that something people should be checking at home too?
Home blood pressure monitoring can be really helpful, especially for folks who might be at risk for high blood pressure, or those who are trying to manage their blood pressure through lifestyle changes or medication. Luckily, these home monitors are pretty easy to find and use these days.
That's good to know. The training materials mentioned that blood pressure can fluctuate throughout the day, based on things like posture and even emotions. So I imagine it's important to be consistent with how and when you take those readings to get an accurate picture over time.
You're absolutely right. Ideally, you want to measure your blood pressure at the same time each day, preferably when you're feeling relaxed and haven't had any caffeine or done any strenuous activity recently. And of course, keeping a log of those readings to share with your doctor is key.
Now, I'm wondering about temperature. It seems like most people only break out the thermometer when they're feeling under the weather. Are there other reasons to keep an eye on your temperature?
Definitely. For women who are trying to conceive, tracking their basal body temperature, that's their temperature first thing in the morning before getting out of bed, can be helpful for family planning. It can help pinpoint ovulation.
That's right. I'd forgotten about that method.
Yeah.
Are there any other situations where being mindful of temperature could be helpful?
Well, if you're recovering from an illness or surgery, keeping tabs on your temperature can help you spot any signs of infection early on. And for older adults or people with weakened immune systems, regularly monitoring temperature can be an important part of staying on top of their health.
This all makes me realize that our bodies are constantly giving us clues about what's going on inside. Vital signs are like a language we can learn to understand.
I love that analogy, and the more we understand that language, the better we can advocate for our own health and well-being.
So true.
Yeah.
Now, before we get too philosophical, I wanted to circle back to those abnormal breathing patterns we touched on earlier. They sounded a bit intimidating, especially for someone new to healthcare. Could you break down a few of them for us?
Of course. Let's start with one that might sound familiar, stertorous breathing. Have you ever heard someone snoring so loudly it sounds almost like a struggle?
Oh yeah, my dog is a champion stertorous breather.
Well, in humans, stertorous breathing can indicate a partial airway obstruction. So while it might be funny coming from a dog, it's definitely something you'd want to take note of. And report immediately if you hear it in a patient.
Okay, so stertorous breathing is basically really loud snoring that could signal a problem.
Got it. Then there's Cheyne-Stokes breathing. I vaguely remember that term from a medical drama once, but I have no idea what it actually means.
It's a very distinct pattern, where the breathing gradually increases in rate and depth, then becomes shallow and slow, followed by a period of apnea, which means no breathing at all. Then the cycle repeats.
Whoa, that sounds a bit scary.
It can be a sign of serious medical conditions, but it can also occur during sleep in some healthy individuals. It all comes back to context, right? It's all about those patterns and understanding when they might be cause for concern. What about labored breathing? Is that just someone breathing really hard, like after they've run a marathon?
While exertion can definitely cause labored breathing, it can also be a sign of respiratory distress. Think of it like this. Imagine someone is trying to suck air through a straw. You can see them working hard to get each breath. Their chest might heave, their nostrils might flare, and they might even be using those muscles in their neck and shoulders to try to help pull in more air.
So it looks like breathing is hard work.
Exactly. It's a sign that their body is working harder than usual to get enough oxygen, which could indicate a problem.
Okay, let's tackle two more. What's the difference between dyspnea and orthopnea?
Dyspnea is simply the medical term for difficult or painful breathing. It's really about how the person is experiencing their breathing. Orthopnea, on the other hand, is a more specific type of breathing difficulty that occurs when someone is lying down. People with orthopnea often need to be propped up with pillows or even sit upright to be able to breathe comfortably.
So someone with orthopnea might be sleeping in a recliner.
That's a common scenario. It can be a sign of certain heart or lung conditions that make it harder for the body to circulate fluids when lying flat.
This is all so fascinating, but I have to admit, it's a lot to take in. There are so many things to pay attention to and so many potential red flags. Do you have any advice for our listener who might be feeling a little overwhelmed by all this information?
I completely understand. It can feel like a lot, especially when you're first learning about vital signs. The key is to remember that becoming proficient at observing and interpreting these signs takes time and practice. Don't expect to memorize everything overnight. Focus on understanding the basic concepts and gradually build your knowledge.
And don't be afraid to ask questions. Even experienced healthcare professionals lean on each other for support and guidance.
Absolutely. Collaboration and a commitment to lifelong learning are essential in healthcare.
Okay, so we've covered the 5 vital signs, the why behind them, and some common abnormalities. What else should we know about this topic? The source materials seem to emphasize the importance of documentation. Is there anything specific we should keep in mind when recording vital signs? It seems pretty straightforward, but are there any common pitfalls to avoid?
You're right, documentation might seem like a no-brainer, but it's absolutely crucial for effective communication among healthcare providers. Clear and precise documentation ensures everyone is on the same page and can provide the best possible care for the patient. For example, imagine you're a CNA and you've just taken a patient's temperature rectally. You record the temperature as 101 degrees, but you forget to specify that it was a rectal reading.
Oh, no. I can see where this is going.
Right. The next person looking at the chart might assume it was an oral temperature, which is typically a bit lower. That could lead to a misinterpretation of the patient's condition and potentially affect their care.
Wow, so a seemingly small oversight could have a big impact. What else is important to keep in mind when documenting vital signs?
It's essential to note the time the vital signs were taken, the patient's position, were they sitting, standing, lying down, and any factors that might have influenced the reading. For example, if someone just finished a strenuous physical therapy session, their heart rate and breathing will likely be elevated. Documenting that context gives a more complete picture of what's going on.
That makes perfect sense.
Yeah.
What about reporting abnormalities? The training materials mentioned reporting these to a licensed nurse. Is that always the protocol?
Yes, absolutely. As a CNA, you're the eyes and ears on the ground gathering important information about the patient's condition. But it's crucial to communicate any significant findings or changes in vital signs to the nurse, who can then assess the situation and determine the best course of action.
So even though CNAs are often the ones taking those initial measurements, they're not making decisions about treatment based on that information.
Exactly. CNAs play a vital role in data collection, but the interpretation and decision-making ultimately fall to the licensed nurses and doctors. It's a team effort.
Well, before we wrap up this part of our deep dive, I have another question for our listener. We've been talking about these measurable vital signs, but what about those more subtle cues our bodies give us? Things like feeling unusually tired, changes in appetite, or even just a gut feeling that something isn't quite right. How do we learn to tune into those signals, and what do we do with that information? It's something to ponder as we move into the final part of our deep dive. Welcome back to the deep dive. Before we took a moment to think, we were talking about those less obvious signs our bodies give us. Beyond those measurable vital signs, it makes me think of that saying, listen to your body.
It's so true. Our bodies are constantly communicating with us, sending subtle signals that something might be off. It's just a matter of paying attention and learning to decipher those messages.
I know I'm guilty of ignoring those signals sometimes, especially when I'm busy or stressed. But those feelings of fatigue, changes in appetite, or those nagging aches and pains, they're all trying to tell us something. What are some of those subtle cues we should be more aware of? And how do we know when it's time to seek medical advice?
That's a great question. And it's something that's often overlooked in healthcare. We tend to focus so much on those objective measurements, like vital signs, that we forget about the subjective experience of the patient. But those subjective cues can be just as important, if not more so in some cases.
So what are some red flags we should be looking out for?
Well, persistent fatigue that doesn't improve with rest is definitely something to pay attention to. It could be a sign of a variety of underlying medical conditions, from anemia to thyroid problems to even depression. Similarly, unexplained weight loss or gain, changes in bowel habits, persistent headaches, and new or unusual pain that doesn't go away, those are all reasons to check in with your doctor.
What about those more vague feelings like just feeling off or not myself? Are those worth paying attention to, or are they just signs of everyday stress?
I think it's really important to trust your gut instincts when it comes to your health. If something feels off, even if you can't quite put your finger on it, it's worth exploring. It could be nothing, but it could also be your body's way of telling you that something needs attention.
That's a good reminder to not just dismiss those feelings. What about changes in mood or behavior? Could those be related to underlying health issues?
Absolutely. Our mental and physical health are interconnected. For example, conditions like thyroid disorders or vitamin deficiencies can manifest as mood swings, irritability, or even anxiety and depression. So it's always important to consider the whole picture when assessing someone's health, not just their physical symptoms.
It sounds like healthcare is really as much an art as it is a science.
That's a great way to put it. It's about combining those objective measurements with the subjective experience of the patient to get a complete understanding of what's going on.
Well, this deep dive has certainly opened my eyes to the complexities of vital signs and the importance of paying attention to those subtle cues our bodies give us. Any final words of wisdom for our listener before we wrap up?
The key takeaway is that knowledge is power. The more you understand about how your body works and what those subtle signals mean, the better equipped you are to advocate for your own health and well-being. Don't be afraid to ask questions, seek out information, and trust your instincts.
That's great advice. Thanks for taking us on this deep dive into the fascinating world of vital signs.
It's been my pleasure. Until next time, stay curious and keep exploring.
And to all our listeners out there, thanks for joining us on the deep dive. We'll catch you next time.